Hi, everyone in the room. So we're very excited to be able to welcome our virtual host today. Dr. Heather Escher Miller is a professor in the Department of Nutrition Science at Purdue University. She's a nutrition epidemiologist with experience in program evaluation, dietary data analysis, and patterning, and nutrition education and dietary behaviors with a focus on low resource populations. She has held various membership leadership roles in ASN and currently serves as the vice president-elect of ASN. She's also a member of the board of editors for the Journal of the Academy of Nutrition and Dietetics and Advances in Nutrition. Dr. Escher Miller recently served on the 2025-2030 Scientific Committee for the DGAs, and she was selected as the 2023 to 2024 Dannon International Prize for Alimentation Laureate. I probably butchered that pronunciation. But we're so happy to have you. Dr. Escher Miller did a talk for our GGNB students earlier this year, right when the DGAs were released. And this is going into more of sort of like an overview about the process and also her experience. So I've told her that we have a really active audience. So we're going to try to do our questions at the end, and we'll also take questions virtually as well. So I'll be monitoring the chat. So in that, Dr. Escher Miller, feel free to start.
Great, thank you so much. And it's just such a pleasure to be here. Yeah, I'm really excited to talk to you more after I finish talking and answer your questions. So I'll go ahead and share my screen. And is that, you guys can see that?
Yes.
Okay, great. So what I wanted to do today is kind of overview the dietary guidelines process and then also kind of highlight some of the differences in the process this time compared with other times. And then after that, I wanted to kind of go into what are some of the differences in the content of the report from the advisory committee and then ultimately the guidelines that came out. And, there's always differences in those two things, but I just kind of want to contextualize those a little bit more and then also highlight some of the similarities as well. And then in the last part, I want to kind of bring out some things that I think are really important about the work that is documented in the advisory report and then take discussion after that. So let's go ahead and get started. And I did want to kind of just let you know all of my disclosures are here. And so just to first kind of lay a foundation of what the dietary guidelines for Americans are, I think probably everyone online and in the room have an understanding of this, but just to quickly overview that, the guidelines really serve as the cornerstone for nutrition policy in the US, and they flow out to one of the biggest impacts is just going to inform a lot of the programs that the government delivers as far as food. The guidelines, they summarize the relationship on diet and health and then give us actionable patterns to follow to meet nutrient needs. And they are mandated by the National Nutrition Monitoring and Related Research Act of 1990 to be updated every 5 years. And that's done jointly by the two units of USDA and DHHS. So they take turns leading that process. And for the advisory report, this time it was led by DHHS. Also, every time the guidelines are done every 5 years, usually there's like something new or some expansion. And so, for example, in the 2020 to 2025 version, they expanded to cover the whole lifespan, including ages 0 to 2, and breaking down the report by those different life stage groups. And in this time of reviewing the evidence for the advisory committee report, the way that we uniquely expanded was to consider health equity and really try to recognize diversity of different population groups and trying to bridge those health equity gaps in every way that we evaluated the evidence. So that was a very important part that we did that was novel this time. And then also just to mention that each time the guidelines is updated, it's not just kind of redoing things. It's supposed to be bridging out to build from the prior guidelines to build more into the next version. So sometimes questions could be reevaluated, but it's because there's like more evidence in that next time they're done. So, and then I just also kind of have shown here some of the visuals or the visual dietary guides that are linked with sometimes multiple versions of the guidelines that come out. For example, my plate has been carried on from several different dietary guidelines, but anyway, it was changed for this newest version of the guidelines that came out. Then there's also kind of like a process to updating the guidelines. So the first step is one of the first steps is the advisory committee is charted, and then they hold public meetings. All the meetings of the full committee are public. There's a lot of opportunities there for getting public comment and also for sharing what's happening so that the process is transparent. At the end of that time, the advisory committee is released, and then the committee are done. Like their role is stopped. They, as a committee, we don't have a role in actually making the guidelines. That's always been the job of the government. So the advisory committee report has usually been a strong basis for making the policy, but it is USDA and HHS who will work together to make the policy. And so then once the dietary guidelines as a policy is released, then it can be implemented through all the different federal programs. And that can take a while. It's not like it happens right away. Sometimes there have to be some changes to in the support of those programs to actually implement the guidelines. And also messages to the public can come out of that. So I wanted to recognize all the individuals who were part of the advisory committee this time. And they're all shown here. Dr. Sarah Booth from Tufts was the chair, and Dr. Angela Odoms-Young from Cornell was the vice chair. And then as a committee, whenever we would have weekly meetings for various subcommittees, and each of us generally served on 2 or 3 subcommittees. So, for example, I was on the the data analysis and food pattern modeling subcommittee as a co-chair of that committee. And then I also served on the committee that was dedicated to evaluating child feeding patterns. And then I also was on the health equity subcommittee. And so we were each on multiple subcommittees. And each of those committees would meet every week. And then there was often like pre-work for those meetings. So it did require a lot of extra time. I would say probably at least extra 10 hours a week. But it could kind of vary, more or less. But it was, and that was for 2 years. So it was kind of a lengthy commitment. So now I just want to highlight some of the ways that the process was different this time for creating the guidelines. So as I mentioned before, one of the first aspects of updating the guidelines is identifying the committee, and actually before that, identifying the questions that will be addressed for the next version of the scientific report. And that happens like almost right away after the guidelines are released for the prior set. So for example, once the 2020 to 2025 dietary guidelines were released, in 2020, then the government units go to work right away in 2021 to identify what questions will be asked as part of the next version. And these are partly driven from the scientific report of the former committee. Also, there's public comment that's taken to inform those questions. So it's a very kind of transparent process. And people are identified to be on the committee partially because of what those questions are. So then the committee are appointed, and again, this is also publicly released once the committee are selected, but the process of selection is also solicited firstly from the public. So nominations are solicited, and you can submit your, if you're interested in being part of the committee, you can submit the materials that they request to them, and then the government evaluate all of those and kind of find people who are well matched to the questions, but also they want a committee who are balanced as far as being from various locations in the United States, representing different institutions, and then also different backgrounds and different areas of science. All those things are important in having a committee that can evaluate the evidence from multiple perspectives. So then, as I mentioned, once the committee are appointed, that's publicly released, and then they get to work having meetings. And all these, there's 3 meetings a year that are full meetings, and those are also broadcast online. So actually the meetings from at least this set and the committee before are available to view online. And then at the end of 2024, the advisory committee released their scientific report. And then, as I mentioned before, that is, their role is done, and there again is public comment that is solicited from that report to help advise making the guidelines. So this is where the process then kind of diverged this time. So once the committee's scientific report was released, then the government does have till the end of 2025 to complete the guidelines. So the guidelines didn't come out in 2025 because of the government shutdown. They came out in early 2026. But at the time they were released, there were also the release of several other documents that we didn't know were being created. And so one of those was a scientific foundation report that the government used to actually create the new guidelines. They didn't fully ignore the scientific report created by the advisory committee, but they only used some of those, they only carried forward some of those recommendations into the new guidelines. And they did base their new guidelines heavily on that new report. So that was not a very transparent process because we didn't know that that was happening, and we didn't know that there were new reports being created. There were also a new set of dietary patterns that were also recommended. So now I'm going to just point out a few more things about how the process was different between the DGAC and the DGAs. So as I mentioned, we did have scientific questions that were transparently posted for the public and identified partially by the prior committee for the DGAC, but for the new DGAs and their reports, these questions were derived from the government with no public input, and they were assigned to 9 experts who would write the chapters to address those questions. The scientific authors process was also different. As I mentioned in the DGAC, public nominations were requested and the advisory committee members' names were released before they started meeting. They worked together as a committee and really discussed as a full committee, discussed the findings in public for everyone to understand. Also, we as the committee, we served without pay as volunteers. But for the new reports, the experts were appointed by the government and the names were not released until the reports were released. These people worked as individuals and they were paid for 3 months. Then as far as the methods, in the DGAC, the methods were kind of documented and very transparent. Also used some very systematic methods, best class methods for the data analysis, for the systematic reviews, and for the food pattern modeling. For the new DGA's reports, the reviews were narrative. They included different types like narrative reviews, umbrella reviews, and I think 1 or 2 systematic reviews. They didn't use data analysis or recognize current intakes, which are addressed with the data analysis in the methods of the DGAC, and they also didn't carry out food pattern modeling. So I just want to highlight these methods too, actually. For the 3 methods that the DGAC used, these all really support each other. The data analysis is where we look at what food intake is in the United States, like what the healthy eating index is, what all the different intake of the different dietary components are, nutrient intakes, etc. And that's important to understand where we're starting from. Like if we want to make guidelines that can really be utilized, we have to know where we're starting from. The systematic reviews then address the scientific questions of like, how do dietary patterns relate to different health outcomes? And again, those are very rigorously done. Finally, the food pattern modeling is where once the patterns are created, like for different kilocalorie levels, we need to know, how much servings of each of the different food groups, for example. Then in food pattern modeling, we actually test those patterns to see if by eating that way, you could meet all the different nutrient recommendations. So that's a really important kind of like check on what the committee have recommended. But yeah, as I mentioned, some of these methods weren't completed for the new dietary guidelines reports and basis of policy. Also, the DGAC again highlighted health equity and considered that in all the methods, so that what we produced and what we recommended would be, considering a lot of the diversity of the way we eat and by different characteristics in the population. But for the new dietary guidelines, health equity diversity was not considered. And then just the meeting style, again, we're very public and transparent for the advisory committee, but for the new dietary guidelines, most of that wasn't shared with us before it was released. So that's differences in the process. Now, what about content? And before I talk about those differences, because I think those are a lot of people know a lot of those, and I'll kind of review those. I did want to highlight the similarities because honestly, there's a lot of big things that are similar. And I think this kind of helps us, see how the evidence of nutrition science can kind of carry through and still does carry through to the guidelines. Even though, and like I said before, there's always differences between the advisory committee report and the actual policy of the guidelines. So it's just that this time those seem a little bigger, but there's also similarities. So some of the similarities are that both recognize the really high prevalence of chronic disease and obesity in the US. And this is really the motivator for having dietary guidelines because we know diet is a big risk factor for chronic disease and obesity. Then also about 14 of the advisory committee recommendations were accepted in the new dietary guidelines, and about 12 were partially accepted. So there are some things that carry through. We also had both documents recommending one dietary pattern that could be implemented with wide variety. Instead of having, like in former guidelines, there have been different patterns like healthy vegetarian pattern or Mediterranean pattern. But this time, the DGAC as well as the DGAs emphasize having just one pattern that could be implemented in different ways. Also, the main food groups in the patterns are the same. The subgroups are not, but the main food groups are the same. And then these last two, I think, are really important. These are some of the main messages coming out of both of these documents. And those are encouraging nutrient-dense foods, whole grains, fruits, vegetables, dairy, a variety of animal and plant protein sources, and then limiting added sugars, sodium, and maintaining saturated fat limits. So those are consistent. And I think, those are some of the main things that the public really don't do. And we all need to kind of work on a lot of those areas. We haven't solved them yet. So I think those are still things that we can emphasize, despite some of the discrepancies in these two documents. So now I just wanted to mention what are some of the differences in the actual content of the advisory committee report and the policy that is the dietary guidelines. So obviously the visual is different. We've seen the inverted pyramid, and within that we have a lot of images of certain foods as well that are kind of highlighting what we're, I guess, supposed to eat. And some of those are kind of confusing with regard to meeting those saturated fat limits. For example, the big steak, butter, those things are like we could only incorporate those in limited amounts if we really wanted to meet those saturated fat limits. In the DGAC, we still were saying my plate is a great visual, and there were no individual foods that were shown as part of that. As far as messaging, the DGAC is really written for professionals, as was more the past 2020 to 2025 Dietary Guidelines for Americans policy document, whereas the new dietary guidelines are some of it, online content is kind of really out there for the public and inviting the public in. So that's a little bit of different audiences they're targeted for. In the DGAC, protein foods nor processed foods were really a big emphasis, but those are both emphasized in the new dietary guidelines. So we have some phrasing like ending the war on protein, and even protein targets being increased. also processed foods being emphasized and saying avoid highly processed foods, eating real foods as part of the new dietary guidelines. There's also different messaging on alcohol actually a separate report is done to address alcohol for the advisory report, and that suggests limiting alcohol to 1 drink or less for women and 2 drinks or less for men. And then for the new dietary guidelines, the messaging is consume less alcohol. So we don't really have a grounding or a starting point for that. There's also differences in the actual patterns themselves. So in the DGAC and former guidelines, we have amounts of the different food groups and subgroups in ounce equivalents per day, whereas in the new guidelines, they're in servings per day. So that's a little bit difficult to translate. And then in the DGAC and former guidelines, we had food groups and subgroups, but in the new guidelines, all the subgroups have been removed. So it's just larger food groups that are there. We also, this is kind of, I guess, one of the bigger things, have a difference in changes to the patterns. For the DGAC, we recommended some very slight changes to a few of the food groups, but nothing major. Whereas in the new DGAs, they recommend approximate doubling of protein foods, some slight increases in vegetables, and the other big thing is refined grains are totally removed from the patterns. And then just in the calls for action, for the DGAC, we have a real focus on implementation. Like, we know a lot of people don't follow the guidelines, so maybe in in the next revision of the guidelines, that would be something to follow up on, like more on behavior science to actually help people change their dietary behaviors. And also the continuing need for attention to health equity as far as diet is concerned. But neither of these were of focus in the new dietary guidelines. So now I just wanted to, in my last part, talk about a few things that I think were really important in the advisory report that aren't actually being talked about much now. And they weren't highlighted in the new dietary guidelines. And so those are things, especially from the data analysis and food pattern modeling that we did. And I also think people might not understand exactly what those methods do and what they're for and what benefit they have. So first, I think health equity and the attention on implementation are really important to keep as a thing we want to keep doing in research, and we want to keep doing as far as getting people to change their diets. I think having these as part of the guidelines is a step towards precision nutrition. Like, obviously for public health, it's focused on the public, so we can't get too precise, but we can, recognize how the way we eat and the environments we're in and our own personal characteristics are going to kind of perhaps change the relationship of our diet with our health. And I think that's really important to kind of get an understanding of what dietary intakes are by all those different factors. Because, if we're advising programs that are targeted to certain groups, like let's say the WIC program, we have various age groups and sex groups included in the WIC program. And if we're going to try to improve diet in that program, we really need to know what diet looks like in those groups. So that's very important for the guidelines to address. And these aspects impact us over our whole lifespan. So it's important when we think about implementation that we really understand fully the diversity of diet in the United States. I think nutrition science, it's not kind of a science where once we learn how nutrition impacts our health, we're done. It's nutrition is important because we need to actually put it into action to improve our health. So that implementation piece is really important. In to do that, we have to understand how it could be different. So just to kind of show an example of this, as part of the dietary guidelines, data analysis that we did for the advisory report, we look at diet quality. And so that's a metric that goes to 100, indicating full adherence with the dietary guidelines for Americans. So we can see that when we look at the whole population, or ages 2 and older, our score is about a 56, and on a grade scale, that's an F. So that's not good. But when we break that apart by things like sex and age, we can see the diet quality really, there's definitely a range. And that's important for informing programs, helping people change their diets, all those things. It's also going to be different by race, ethnicity, and by income. And of course, a lot of other things too. I think it would be really important in the future to do more intersectionality of these different characteristics or living situations like PIR, so that we could have an even deeper understanding of diet quality for different groups of people. And again, we could think about that aspect with regard to the different components of diet quality. So those components are shown here. This is again for the whole population ages 1 and older. And if we look at the green bars, we can see the percent of the population that are adhering to those guidelines for the different components. And so you can see it's not very good for vegetables, for fruits, for whole grains, especially for dairy and seafood. But it's better for things like total grains, refined grains, total protein foods, and meats, poultry, and eggs. But when we split that apart again by age and sex, we can see actually a huge range in meeting those different components for a lot of different food groups, for all the food groups actually, but for fruits, it's especially dramatic. There's a 79, almost 80% range. So we can see that like for adolescents and young adults, they have really poor meeting of the fruits recommendation, but for very young children, they're really meeting that well. So that's very important for us to know, in thinking about changing diet and improving health in the US. Again, we see that when we look at sex, we can see a range of 32% for protein, meeting the protein component recommendation for 14 to 18-year-olds, and also for by race ethnic status, 16% range for vegetables, and also for the income, for poverty income ratio at 8% there. So that's important. I think, again, I really hope that all the advancement we've made in recognizing differences in diet by these different factors keeps progressing and doesn't kind of get lost, because it's so important for for dietitians who are out there in practice, but also for us to keep as researchers to keep advancing science, and then people in government to advance policy. And I just put some examples here of some ways that this information can be helpful in that way. Um, so I think I'm kind of running out of time, but one more thing I will just mention is I also wanted to highlight the food pattern modeling and just briefly explain that a little bit more. I think that was a really, that's the aspect method of of creating the scientific report that's been kind of gaining in rigor and what is done there over time. And so I just wanted to highlight that to show you how important it is. So as I mentioned, this is a way to really evaluate these dietary patterns that are recommended. And so here you can see, I know it's small, but there's kilocalorie levels at the top. So for example, infants would be at the 1,000 calorie level. A lot of adults, especially women, are at the 2,000 calorie level. Male adults might be more at the 3,000 calorie level. But these outline the different amounts of food groups that should be consumed to meet high diet quality, and we're saying, that if you eat this way, you'll fulfill the nutrient requirements, which are shown on the right. So in food pattern modeling, we actually test that. If someone, if the pattern is followed, will you meet the RDAs and AIs for all these nutrients? And to just briefly say, to do that, you have to create a nutrient profile for for each food group. So this is for red and orange vegetables. And to create the nutrient profiles, of course, you have to break down, base that on population intake. For example, we know that for red and orange vegetables, they're mainly going to be tomatoes and carrots that are consumed. So we can break that down and then grab the nutrient composition of the proportions that are represented. And in food pattern modeling, we did this for the whole US, but we also checked those different like age, sex, race, ethnicity groups to make sure that this was really capturing we weren't ignoring some diversity there. And then again, we can determine if the recommendations are being met. So just a quick example, if we look at dairy for protein and several minerals, you can see the contribution of dairy is shown in green to each of those kilocalorie levels on all these different protein and mineral graphs. And in the top row is when dairy is included in the pattern. When we take dairy out of the pattern, you can see what happens to the nutrient requirements, which are the dotted lines going across the graphs. For example, for calcium, without dairy, almost every age, sex recommendation actually all of them can't meet the recommendations for calcium. So you can see how important dairy is in fulfilling calcium in the patterns. Now that's just totally removing dairy. But, so we did that, but we also did a lot of optimizing. So like, what if we raise one and lower another? And then we kind of came up with some slight modifications, as I said, to the patterns that we were recommending. That would give us gains in certain nutrients like folate here and fiber. But just wanted to highlight in the new patterns that are in the dietary guidelines, even though protein foods were recommended to basically be doubled and refined grains were totally removed, these were not evaluated in food pattern modeling. So they didn't check to see if someone following this pattern then would actually meet nutrient requirements. So just to kind of show, if refined grains is totally removed, there will be significant gaps in iron and folate in several age sex groups. So that is everything. And just to kind of summarize, the dietary guidelines are very important. They inform a lot of our programs, the biggest one probably being the school lunch and breakfast programs. The process that's established is very transparent and rigorous. And, public comment, a lot of different views are taken into consideration. And this is released. However, the new guidelines process was not very transparent or public. But many of the main messages of the DGAC and DGA are similar. Some of the ways they differ, though, are this difference in the protein food recommendations, the removal of refined grains, the imagery, the rigor, and just de-emphasizing of kind of meeting people where they are and recognition of all the diversity in the US as far as their diets. So that is all that I have, and I would love to take any questions.
Thank you so much, Heather.
Let me stop sharing.
Okay, good. We have the whole screen now. So we have about 10 minutes for questions, and Heather did a great job at sticking to time because I knew that we were going to have an active audience. So I wanted to see if there's any questions in the room so far. Debrina looks like she's Debrina.
Yeah, thank you so much. That is really interesting. So I have a question about the food pattern modeling that the DGAC did. Was there any questions that you tested about processed foods and ultra processed foods? I think what I recall there's also a question about using animal protein versus plant protein. I think I saw that if I'm so yeah, I think I see a couple of questions that you tested with the food pattern modeling, but I'm curious about the ultra processed foods and processed foods. Were they also in the list of questions that you explored?
Yeah, that's a great question. So we did talk about doing that at the very beginning of our meeting as a subcommittee. We evaluated the scientific questions that we had, and we had to kind of prioritize the ones we really wanted to do, and then have an intermediate group, and then a group that we were deprioritizing. And we talked a lot about each of those. And I remember, the question of doing food pattern modeling with ultra processed foods was on that list. We did talk a lot about that, but we did just feel like we didn't have a very scientific way to operationalize that and to actually, because, there are various ways of classifying processed foods, ultra processed foods. And we really didn't feel like there was scientific consensus in the literature for doing that. And so we did deprioritize that question just because of a lack of being able to really make, evidence-based decisions on how we were going to do that. So we didn't do it there, but as you probably know, they did address some questions in the systematic reviews on ultra-processed foods.
Great. Hussein?
Yeah, thank you so much. My question was could you talk a little bit about in the previous cycle in 2020, how many of the DGAC recommendations were accepted? And more generally, what mechanisms are in place kind of for holding the government accountable for adopting the DGAC recommendations, if there are any mechanisms, versus just kind of relying on good faith? So yeah.
Yeah, so I haven't seen a document that outlined for prior committees and reports how many of the recommendations of the advisory committees were actually implemented or carried forward. I don't think that those are there. Like I said, there always have been discrepancies, but I don't think that was actually a really nice thing about this dietary guidelines was that in a sense that they did clearly outline which ones they accepted and which ones they didn't. But I
Um,
did someone.
we have someone in the audience who was on the DJAC from the previous guidelines that may be able to weigh in. So,
That would be
Doctor,
great. Yeah.
could you comment here?
Sure, but first I want to thank you, Heather, for a really excellent presentation. You really went through all of the issues so well, and I would like to know if there's any chance that your presentation could be made available in some way or another, so people could basically get on board with what you've shown. It's not that well publicly appreciated, so I really think it was excellent, especially the aspects of process that were not followed this time around. So I can answer the question about the last DGAC because they did actually adopt almost all of the recommendations. The two that were slightly different were the ones on alcohol and restriction on sugar. But to their credit, they actually published a statement about why they didn't completely adopt those, and they gave their rationale. You can agree or disagree with their rationale, but at least they made the effort. And that was available online at the DGA website. I don't know if it's still that easy to find, but it was there. But I have a question regarding the next phase, because as you mentioned, it takes years for the preparation to occur before the next set, which would be technically 2030. So I'm assuming they would normally have to start in 2027 or at the latest 2028, but I'm not sure the political situation will be any different than it is now in terms of how motivated they are to follow that process. And I don't remember how much that process is supposedly binding on the HHS and USDA. So do you have any thoughts about what's going to happen the next time around here?
I don't really know, unfortunately, how I do know that there is some, kind of discussion about what the best way forward would be. And from the Dietary Guidelines Advisory Committee side, when we were making our report in future ways to push forward at the very end of the report, we did say that maybe reconsidering the timeline should be something that's done, because it does seem like it, there is a place for maybe not doing the report every 5 years, but every 10 years, for example, so that there's more chance for the evidence to really compile, or to also, as I said before, kind of doing a focus on implementation, and then for 5 years, and then the next 5 years focusing more on reviewing the science, just so there has a little more time to gain significant information about what we know about the diet health relationship. But yeah, other than that, I'd have to say I don't know what they're gonna do. But again, thank you so much for your service and for your comments. I hope everything was well received. So thanks.
Well, and thank you for your service. It is a huge amount of time, so we really appreciate it.
We have time for one last question. So, Christine, if you could unmute yourself.
Hi, Heather. Great to see you. And thank you so much for coming and talking to our group. And just to echo, thank you for all of the time and effort that you put into serving on the Scientific Advisory Committee. And I have read the report that you all put together, and it was really, really well done. So nice job on that. I guess my question and comment, a couple, is kind of in the nitty-gritty, just thinking about like the protein recommendations. You highlighted that the protein had gone up a bit, a fair bit in the version of the dietary guidelines that was released. But another difference is that the protein recommendations were on the basis of um, the nutrient itself rather than in terms of food groups of or servings of foods from the protein food group, right? And so that's a bit of a difference because then it's sort of conflating the RDAs or the DRI values, I mean, with the food-based dietary guidelines. And I think that that can be confusing to the public. And, we're seeing right now this proliferation of ultra-processed foods that are are advertising themselves as high in protein. And I worry about the public seeing how many grams of protein they should be aiming for and choosing the easiest option, which is the packaged food that has how many grams of protein are front of pack. So, I mean, I think that that's one thing that kind of caught my eye as a big difference was kind of conflating the DRI nutrient values in terms of grams or milligrams with food-based dietary guidelines, which had previously been in terms of food group or serving sizes. And then, as you say, there's also a bit of, I think, confusion about like who the report is really aimed at, like historically it being aimed at professionals, but yet the visual image is aimed at the general public. And so kind of think going forward, there needs to be like some thought that goes into like what these different reports and what these different tools, who the audience is, who they're aiming at, and how the communication gets filtered down to the different audiences. So again, just emphasizing like you brought it up, implementation is so important, and I think actually implementing these guidelines is going to be even more challenging than it was in the past because of these issues.
Yeah, those are great points. And I just think it's also kind of in the face of what we do see as far as groups meeting, as far as the population meeting the different dietary component recommendations. Protein is one that we're actually not doing that bad at. So is that the one we really want to double down on? But yeah, there is just like a lot of confusion with the different amounts. And like you said, is it the amount of protein grams or the amount of protein foods? I think both were kind of increased in the new thing. And then like there's also the AMDR, so for the acceptable macronutrient distribution range. And so, I guess the amount of protein recommended is now at the higher end of that range or a little that extreme. But yeah, so it's really just quite confusing, I think. And the different units too. Um, but yeah, it's like if I don't know, I get kind of confused honestly with it. Protein's not really my thing, but I can, imagine that the layperson out there is you've got to be confused if you're looking at that. And so um it's yeah, that's why I think maybe we should just emphasize the things that are the same.
Okay, well, let's give a round of applause for Heather for her generous time and service to the DGAs. We learned a lot. I cannot believe 10 hours a week for 2 years you were able to commit. I'm just trying to figure out how you did that on top of everything else you're doing. So thank you so much, and we really appreciate your time.
Thanks for having me. It was great to be here.